Good afternoon. I'm Dina Diorio, Mecklenburg County Manager. I am joined today by Gibby Harris, our Public Health Director, Deputy Chief Jeff Estes from CMPD, Emergency Management Chief White Graham, and Rick Hefner is our sign language interpreter today. So today, as we know, at 5 p.m., we're moving into Phase 2 following the governor's new Stay Safe at Home order. There are multiple differences between Phase 1 and Phase 2, and a lot of that information has already been discussed widely and circulated since the governor's announcement yesterday. A little later today, the Joint Information Center will issue a news release that will show a comparison of Phase 1 and Phase 2, so that information will be in a single document. A few highlights: as we know, restaurants will be able to open inside at 50% capacity, and it also allows salons and other personal service businesses to open with proper safety measures and distance markers in place. Phase 2 will also allow us to begin opening some of the park and rec facilities that have been closed since the pandemic started. Starting tomorrow, May 23rd, driving ranges will be open. We also will be starting to open our summer camps, so effective June 15th through August 14th, the department will offer summer camps at limited locations. We are looking to see how much capacity we can get and ramp up, but at this point it will be limited slots. In addition, our Nature Preserves and Natural Resources Division will be offering summer programming opportunities throughout July and August. In terms of pools, we will be opening the Aquatic Center and Double Oaks Pool in mid-June. The Aquatic Center will be open from Monday to Friday, and Double Oaks Pool will be open on Saturday and Sunday. We are still looking at whether or not we'll be able to open our indoor pavilions at our various parks. We are taking a look at that. And at this time, our practice fields will still be closed for practices and games. So people can go out there and use them, but there's not going to be any organized sports that will be permitted on any of our sports fields at this time. We're also looking how we will begin to open county government. I've asked each of my department heads to submit a phased reopening plan that would comply with state guidance and ensure that our staff and customers are able to conduct county business safely. That will likely not start until July 1, but we are preparing for that and taking all the necessary precautions to make sure that when we do open county government, we do so safely. The Business Leaders Roundtable is finalizing our sector-specific resource guide or toolkit, and that should be available on our website later today. And I think that'll be helpful to businesses in these various sectors that are beginning to open starting today. The other thing the Business Leaders Roundtable will be launching is a public awareness campaign around the importance of wearing face coverings. We've gotten some resources through the Business Leaders Roundtable to compile that campaign, and we've gotten a donation from the COVID Relief Fund to do some paid media. So again, we know how important face coverings are, and we really want to encourage everybody when they leave their home to cover their face, not only to protect themselves, but to protect other people. And on Tuesday night, the Board of County Commissioners voted to establish a coronavirus recovery task force. Commissioner Fuller is working on a framework of what that will look like and a resolution around what the composition and charge of that task force will be brought back to the board on June 2nd for a vote. So at this time, I will turn the podium over to Chief White Graham for an emergency management update. Thank you.
Good afternoon, everybody. I hope everybody has a wonderful weekend, holiday weekend. The Emergency Operations Center remains activated. Today is day 72. We're very pleased with all the operations going on at that facility, but also the leadership that Ms. DiOrio and Ms. Harris and all the other key decision makers throughout our community have taken and will continue to take. There's two different phases that we are currently in from an emergency management perspective, and that is response and recovery, and they happen simultaneously, and so we're very pleased to see all the activities that have been engaged in across our county and our city. A regional point of distribution is currently underway in the city of Charlotte for long-term care facilities. Those facilities have been notified within Mecklenburg County and our region. The pod has been operating for 2 days. Today is the second day. There are 50 personnel operating the point of distribution, the North Carolina National Guard, Charlotte-Mecklenburg Emergency Management, North Carolina Emergency Management, and the Civil Air Patrol. Yesterday, the point of distribution distributed over 88,000 face shields, 182,000 masks, 981,000 pairs of gloves, and over 50,000 shoe covers. That operation continues today, and we expect those numbers to double in size. Charlotte Response Coalition to date has received over $19 million in donations from our community, and everybody should take solace in that. That is a wonderful amount of money. They've also distributed over $10 million of that funding to our local volunteer organizations working this disaster. They have mobilized 5,769 volunteers through our community. Many of those volunteers are working in the Second Harvest Food Bank and also in our food pantries. Total meals provided to date through the Charlotte-Mecklenburg school system equate to 1,518,000, over 1,518,000. So We want to thank CMS for all their hard work and continued support of this event. We continue to support the Second Harvest Food Bank, and also I would direct everybody to charmecresponds.org. It's www.charmecresponds.org. It's very important if you have the ability to give to our community, please do so at that website, and they will get the money out to where it needs to go. Weather, as everybody is aware, it has been a very wet week in our region. We continue with a flood advisory through today for the Catawba River. Charlotte-Mecklenburg Emergency Management has been working with the National Weather Service and Duke Energy throughout the week to monitor the status of lake levels due to the excessive rainfall we have received. Duke Energy has done a fabulous job of moving water down the Catawba River chain and has kept us up to date the entire time. At this time, we believe that we are out of the prime time frame for major significant flooding. However, we continue to monitor the situation. Please remain weather aware by staying tuned to the National Weather Service over the weekend, as we expect storms in the area this weekend and also next week. Continue to monitor lake levels on the Duke Energy Lake View app, which is available for phones. That is all I have today, and I'll turn it over to Ms. Harris.
Good afternoon. I have several things that I'd like to report on this afternoon. As of noon today, our case count for positive COVID cases in Mecklenburg County is at 2,974 cases. We have experienced 73 deaths. We have had a death in a 43-year-old without underlying health conditions. This continues to reemphasize the need for everyone to stay safe and to do what they need to do to protect themselves and to protect others in our community. We've had 17 outbreaks at this point, current outbreaks at long-term care facilities. We have had some facilities come off of outbreak status and others come on. As you heard from Chief Graham, we're continuing to work with those facilities to make sure that they have the resources they need, the guidance they need, and that we're following up to make sure that they're implementing in a way that's going to protect both the residents as well as the staff. Our trends, we have seen a slight decrease over the last 14 days in the percent positives. We have seen a slight increase over the past 14 days in hospitalizations. We continue to watch those trends regularly. We're also continuing to see a bit of a slide in our social distancing, although we are still above the social distancing we were seeing at the beginning of the stay-at-home order. We continue to watch the situation both here in Mecklenburg County as well as in the region and the state around our children with COVID-19. As you have heard, there's been one case reported of the multisystem inflammatory syndrome in children, and we want to make sure that our clinicians are aware of the syndrome and paying close attention to the children who have COVID-19 in our county. In terms of our testing, an update on that, since responding to the state's request that we test 5% of our population in 30 days, we are 40% into those 30 days. Our systems, 2 hospital systems, have tested 20,492 individuals. That's 37% of our goal. So we're 40% of the way in days and 37% of our goal. But I do want to mention the fact that we are not able to track the tests that are done by the private entities in our community, and if we added that to the percentage, I would believe that we are well on target to hit that 5%. We are currently testing folks in priority groups 1 and 2 of our testing plan and moving into considering some of those individuals in priority group 3. Contact tracing. We need our community members to take our call when we call them about the potential of exposure or the fact that they have tested positive. We understand that this is difficult information for people to accept, but we do need them to answer our call. Contact tracing cannot be effective if those who are affected or infected do not do what we ask them to do. The reason I'm bringing that up is we have had reported in the state an issue with a scam, that individuals are being contacted, somebody's trying to sell them something, telling them that they've been positive and that this, whatever they're trying to sell, will be helpful to them. I wanted to make sure that the public understands that public health staff, when they call, will confirm the individual's personal information and ask specific questions and provide guidance regarding COVID, but will never offer to sell an individual any items. Any individual who's received a call who wishes to confirm whether a call is coming from the health department staff can ask for the name of the staff member and then call our COVID hotline at 980-314-9400, option 3, to verify that information. Want to reinforce the fact that we are now out of our stay-at-home order in the county, but not out of our need to be very vigilant around this pandemic that we are still finding ourselves in. The governor has defined his phase 2 as a safer at home. The point is, being at home is safer than not being at home. The temptation to run back to pre-pandemic behaviors is strong. Before going out, ask yourself, how necessary is this trip? And so it's important to follow the advice that we got from our mothers. Just because you can do something doesn't mean you should. This is for our own safety and in our role of supporting healthy community norms. So I ask people to continue to comply with the 3 W's. Wash your hands, wait, social distance, and wear cloth face coverings as recommended when you cannot social distance in the community. We're happy to take any questions now.
Gibby, it's Allison President from the Charlotte Observer. It looks like based on the expanded testing program, you're about 4,000 tests short of where you should be right now. Can you explain if there is a shortfall, and if so, how you plan to ramp up testing to make sure you reach the end goal within 30 days?
Well, one of the issues, as I mentioned earlier, is that we are not getting reports of the number of tests that are being completed by a number of private entities in our community. And we believe that we are on target to reach our goal. The problem is we can't track those tests if they don't provide that information to us. We do have a handful that we are working with to try to get that information and should be able to hopefully address that a little better in the next week.
Gibby, this is Katie Peralta with the Charlotte Agenda. I have a question about the mask wearing campaign. Since masks do seem to be so important in both protecting our own health and that of those around us, why is this just now happening? Shouldn't this campaign have happened like 2 months ago when we first saw community spread in Charlotte?
Actually, we've been talking about wearing masks for a month and a half now. I think what we are seeing as we open things up, there are potentially fewer people who are out and about that are wearing masks, and so we're just increasing the awareness of the need to wear masks moving forward.
This is Joe. This question is for Dina. Do you have any information on the other pools in the county, like Cordelia Park? And what about spray grounds? Will those reopen anytime soon?
Cordelia Park will not be opening, and we are still evaluating spray grounds. We're not sure at this point if they'll be able to open or not.
It's Tony Messia with the Charlotte Ledger. My question is about enforcement. Well, what are some of the resources that the county or the city has as far as enforcement of the Phase 2 order? Is it fire marshal? Is it county health inspectors? Is it police? And how are you devoting any additional resources to enforcing the new Phase 2 restrictions?
Good afternoon. For the governor's order, it is still the state and local law enforcement officers of all the different agencies who are responsible to enforce that order. In a pandemic, of course, as I think you correctly see, it expands into a lot of areas not normally covered through law enforcement, but we'll rely on our partners. For example, if there's a capacity issue, we have resources that at the fire department, of course, that'll help us. And if there's some sort of health code issue, of course, we know our friends at the health department will help us. However, we're still responsible for the enforcement of the order.
Do you anticipate any, additional patrols? Are they out looking, or are they just responding to 311 calls, getting tips and sort of seeing what they see?
Yeah, on this one, we'll take the same approach we did on the first one. This is again, everyone here in the state at 5 o'clock will be entering into a new phase that we've never experienced before. So we know that there's a lot of confusion. There's some gray areas that people have to work through and businesses have to work through. So it'll be the education first campaign to make sure that anyone who has questions, they'll be guided towards what the proper response is. And then after that, as we have to escalate, then of course, we'll take other measures as necessary. But as far as extra patrols go, specifically for COVID, as you may or may not know, we have an ongoing responsibility to public safety to ensure that people are safe when they're out and about and inside their homes. We have violent crime that unfortunately doesn't take a back seat to anything. So that'll be first and foremost in our list of things to do moving forward.
This is Chandler Morgan from WBTV. My question's for Gibby. Question about places opening up and some employees maybe being worried about exposure. Have you all been able to contact trace cases up to now to show just how many essential workers have tested positive, people like grocery store, home improvement workers? And if so, how many of those cases have there been? And if not, then why not?
So at this point, we have not received specific guidance from the state on clusters. And if we are seeing situations where we have multiple cases in a business, we're having additional conversations with that business to make sure they're protecting their staff the way they need to, that they're providing the protection that they need, the cleaning that is needed, and we'll continue to follow up with them if we see new cases. We just received new guidance from the state on clusters that will define what those clusters are and what we need to do in terms of tracking and reporting those. And as I mentioned, I just printed that off on my way down here to this conference. So I don't have specific information on that at this point, but we will be moving forward with that direction from the state.
And a follow-up question to that. Are you worried that since we necessarily don't have that specific guidance or didn't get that soon enough, that this could be a situation like we saw with long-term care facilities where now we have 17 and then in possibly 3 weeks we'll have 17 businesses?
I really cannot predict other than to say that as more people come out of their homes, the likelihood that we will have more cases in this community goes up. We still have COVID in our community. It is still incredibly infectious, and the majority of our community does not have antibodies to this infection. So I would be surprised if we don't see more infections as we move forward. That's why it's critical for people to do the things that they need to do to protect themselves and to protect others in our community as we open things up.
This is Gail Smith with The Observer. With the recent report of the county's youngest resident with COVID-19, with that death and a slight increase in hospitalizations, does that give you any cause for concern with the state moving into phase 2?
Any uptick is cause for concern. As I said, though, we're watching these over a 14-day period. Because that's the life cycle of the infection. So we're going to be watching these data daily and very carefully so that we can respond appropriately if we see any significant increases.
So when would you expect to see, data reflecting that uptick for the county moving into phase 1?
We're expecting to see that impact in the next week. And then we'll be looking for the impact of phase 2 in 2 to 3 weeks after that.
Hey, Gibby, this is Derek Dellinger with Fox 46. Got a question real quick. You mentioned the contact tracing just in the past couple of minutes when you were making your speech. People basically not heeding the call that they've been exposed or test positive. Are you, just to clarify here, are you basically saying that some people who do test positive or have been exposed, or more specifically do test positive, are they going out and not necessarily or to stay in? And how much of an issue is that? And is there anything that can be done to kind of enforce it?
So at this point, for the people who are positive, we are staying in close touch with them throughout their illness until we are able to let them know that they're ready to be released from isolation. I'm not as concerned about the positives as I am about individuals who are potential contacts. We are continuing to stay in touch with them as well as we can, but as our numbers continue to go up, that's quite a few individuals, and as we have more people out in the community, the number of contacts goes up as well. So we're really depending on our community to do the right thing, and we will do our part of it, but we need the community to do their part as well.
It's Hunter with WCNC Charlotte. I just wanted to ask, going into this holiday weekend, I know that we've seen some troubles already on the lakes in the past when boat ramps opened back up. But another thing are a lot of pools around town, specifically apartment complexes. Usually when pools open for the summer, it's spring break around these pools. They haven't been open all summer yet. What are your concerns?
Well, I want to reemphasize the fact that pools cannot open if they are not permitted. We have been proactively permitting pools for the last couple of months, but we have gotten a huge number of telephone calls over the last day and a half since Phase 2 rolled out and people learned that pools can open. Regardless of what the governor says in Phase 2, pools cannot open until they are permitted. And as we are permitting pools, we are talking to them very specifically about the restrictions and the safety and what their staff need to be doing to enforce those things. I would assume that if people have specific concerns about pools, they can contact 311, and we will follow up through CMPD and the health department as needed.
Gibby, it's Joe Bruno. Do you feel comfortable eating inside a restaurant right now?
That's a good question. I don't have any plans to visit a restaurant this weekend.
Why is that?
I am comfortable grilling at home for the holiday weekend.
I have a question for Dina. It's Derek with Fox 46 again. We've heard from gyms, we've heard from bars basically saying that they had spent a lot of money in preparation for Phase 2 to be able to open everything from air purifiers, hand sanitizers, wipes, everything under God's green earth that you can imagine that they've invested in to be able to open up, only to be told literally 48 hours before they could that they couldn't. Are you hearing any pushback from some of the businesses about this, A? And B, do you have anything to say to them about those businesses? I know this is more of a state thing than it is a county thing, but is there, how much of a legit worry are you worried about the COVID-19 spread in those places?
Well, the governor and Dr. Cohn made those decisions based on the data and how they thought those particular businesses would contribute to spreading the virus. So, but I understand completely the frustration, thinking that you might be able to open only to find out that you can't. You know, we're concerned about every business in Mecklenburg County. We want every business to reopen and to be successful. All I can say is that please be patient. And, you know, if people do everything that we need them to do and we really see things going in the right direction, you know, things will open up as quickly as we can get them to open up.
I do have a follow-up real quick before we move on. Is there any indication that Phase 2, that these restrictions for the bars and the gyms, is it going to last the full 5 weeks, or have you got anything from the state as to how long this will last?
Not particularly related to bars and to fitness facilities. Again, the governor and Dr. Cohn will be evaluating the data, and they'll make the ultimate decision whether or not they can open sooner than Phase 3 is expected to begin.
Following up on that last question to Gibby, will you feel comfortable? Oh.
Gibby, this is Brett Jensen. Curious, the state has, of the known deaths in the state, 70% are with congregate living centers. So basically 660 out of the 715 are from congregate living centers. In your data, you say that it's over 50% in Mecklenburg County of the deaths. Do you have a specific number of deaths that are of congregate living centers here in Mecklenburg County?
We do have that data. I don't have it with me now. We can provide that. What I will tell you, again, the majority of our deaths are in individuals over 60 with underlying health conditions. And what we've seen as more congregate facilities have been affected, that more of our deaths are coming from that environment. So I can't give you a specific number right now, but it is a significant number of our deaths.
Gibby, are you planning to, this is Allison from The Observer, are you planning to resume releasing projections and modeling into a possible coronavirus peak as we move into phase 2, and especially as we're seeing an increase in hospitalizations? And also a separate question for Dina, if she feels comfortable going to restaurants this weekend.
So, yes, we will be releasing more information around modeling and projections as we're moving forward into phase 2. So it could be as early as next week.
So I don't have any plans to go to a restaurant this weekend, but I am certainly comfortable doing so.
So that means, Dina, you're definitely not scared, but Gibby, does that mean you're a little apprehensive?
You're just not going to let that go, are you? I am not apprehensive. I have had conversations with a number of individuals about what they have done in their facilities to make people comfortable and to do the social distancing and the cleaning and working with their staff. I am just, I don't eat out a lot to begin with. And so the idea of going out this weekend to a restaurant just hasn't crossed my mind.
Let me change it up then. Would you be interested or would you be apprehensive about getting your hair done?
That needs to be done badly. The answer is no. In a certain situation, and I have again already had a conversation with the individual that cuts my hair. I understand fully what she's putting in place and the safeguards that she's putting in place. So hopefully we'll have a haircut fairly soon.
Gibby, there's been a couple of outbreaks at various construction sites. Have any construction sites or any other businesses been shut down or temporarily closed due to outbreaks?
I'm not aware of any facilities in Mecklenburg County that have been shut down because of clusters or increased number of positives, no. I'm aware of the Tyson facility in Wilkesboro. We've not had anything like that here in Mecklenburg County.
Gibby, this is Chandler Morgan from WBTV. When you say cluster, what do you mean versus cluster and outbreak?
So that's a very good question, and I think what we have gotten today, just today, is some clear definition from the state on clusters for occupational settings, for educational settings, and for community settings. So we will be looking at that, and we'll be able to provide you with more information as we've had a chance to study it. What I can tell you is that almost for every situation where we use terms outbreak and clusters, there's specific definition around that particular disease. And because COVID is so new, that's evolving as we move forward. So at this point, the only outbreaks that have been defined for us by the CDC and by the state have been for congregate facilities. And now they're defining clusters for us. So we will be using that language based on the guidance we've gotten from the state. And we'll take one more question.
Gibby, this is Katie Peralta. I had another question about construction sites. Earlier this week, the county said that was something that you guys wanted to pay attention to moving forward. Are there any known coronavirus deaths related to outbreaks or clusters at construction sites in Mecklenburg County?
No. At this point, there have not been any deaths related to those facilities. Thank you very much.
Have a great weekend.
Enjoy the holiday safely.